we were gonna call this a fireside chat, but notice there's no fire, although I think a lot of the content, I think one of my daughters might call it fire. And notice no chairs, but these two are gonna do an NPR style with NPR staff and NPR recording devices, an interview I can't wait to hear. So on the agenda, I can't remember what we called this, but we really want to look, we had a preview from Nate this morning into what it looks like to stay resilient under attack from a CISO or IT or a hospital management perspective. But CyberMed Summit's about patient safety, about care delivery, and we recently met one of the driving forces behind a petition from nurses in the Ascension attack, not just Ascension, 2 hospitals, I'll get into that. And when I read it, I said, hey, the CyberMed Summit has actually touched on almost every single one of these requests. And it's so amazing to see a nurse or a group of nurses without training intuit and come upon similar ground. So we may not agree about everything, we may want to work with the list, but I thought it was a really important voice to hear, and we're really happy that with very little notice during this active attack, we were able to make this happen. So please welcome Jenna McLaughlin from NPR and Dina Carlisle from the belly of the nursing eye view of the most recent ransomware attack on our nation's healthcare delivery. So please welcome them.
Thanks, everyone. As Josh mentioned, I'm Jenna McLaughlin, NPR cybersecurity correspondent, and I had all my recording stuff in my backpack, so I figured why not bring it out if these folks were comfortable with it. And Dina's a rock star, so she's ready to go. I am lucky to be joined by Dina today, the president of OPEIU Local 40, the Office and Professional Employees International Union at the Ascension Providence Rochester Hospital in Michigan. Bit of a mouthful, but I think I got it all out.
Did.
As I'm sure most people in this crowd know, Ascension, the largest nonprofit Catholic healthcare system in the United States, detected unusual activity in its systems early in May, and that disruption is still ongoing. What followed is a familiar tale of ransomware, shutdown systems, disruptions to care, everything of the sort. But we're lucky to have with us a registered nurse, someone who can actually speak to the real human lives that are impacted by events like this. She's going to offer a different perspective than some of the ones we're used to hearing in Washington. So with that, I want to actually just get out of the way and let Dina talk about her experience that the attack hit her hospital. What do you remember about that day? Take us to that moment.
Well, I represent Ascension Providence Rochester Hospital. I'm the president over 2 hospitals with 2 groups of nurses, service group, and the radiology technologists over at Ascension also. It began May 8th, and if you would have asked me a year ago that I would be at a cyber summit with medicine involved, I would have said, you gotta be kidding me. Now I have never felt a bigger urgency than to partner with you all and gain knowledge from you. I've learned so much just from last night and today that we have to partner and we have to keep the patients safe. And so May 8th, my people over at Ascension called me and they said, we think everything just went down, we're not sure. No Wi-Fi at all. So even using your cell phone was like haphazard. Unlike Nate, who had some segmentation, I'm learning some different lingo here, everything went down. The lab was all on the same service, the radiology was on the same service. All of our services went at the same time, and nothing was communicated amongst anyone. So first of all, the hospital administration came out and they gave all of nursing a packet, and they said, here you go, and that was it. And then there was a lot of confusion. Where is the lab work? Where, the patient care? Where are the patients? The surgical people were saying they had to call every floor to find out which floor the patients were on that were coming down for surgery. So there was a lot of this confusion, nothing from management, no updates. I started reaching out immediately. I said, we want to partner with you. We want to help you get the safety of the patients, we wanna help anything we can do to get things in order to do that. Crickets. We had a meeting set up, like we have a bi-monthly meeting. They said, we don't wanna have it, they canceled it. I said, you've gotta be kidding. I demanded they meet with us. One person who normally attends was all that they sent. She was non-medical, and she said, give me your questions. And then I said, you've gotta be kidding me. You go back and tell them I'm going to the press. Then until you can communicate, we're done. And so they didn't. So as things continued, every day these nurses and our radiology staff would get different papers every day. Something would be added to their pile of medical papers to fill out for the charting for the patients. Now, I've been a nurse since '96. I've done paper charting. There's so many of our younger nurses who have never, ever done paper charting, to the point of even, I would sign Dina Carlisle, June 13th, 1445, whatever. They never did this. They never learned these things in school. So this is all like an anomaly for them. So there was no training for any of that. They continued to do elective surgeries just like it was any other day. And of the 2 hospitals I represent, this is the smaller one. There was a day they did 38 surgeries with folks going in with no lab results. That's unconscionable, but it sure is making money. So finally, they didn't meet with me till May 31st. And I warned them then. I said, you've got to update us. And they knew we had spoken to many people in the press that we were concerned about the safety of our patients. But the biggest thing is that worries me, all of you understand the impact of this, but the average person doesn't understand what an impact this is on their safety in a hospital. There's lab work that wasn't returned in a timely manner. There's troponins, which are, which help us tell if you've had a heart attack or not. They're all out of order. They're not getting to the right place. We also wonder now in retrospect about the cost to the patients. These people all had, for example, an echo done right before the system went down. And then the cardiologist is saying, I need to see what your results are. I can't see Ascensions. You're gonna have to go to another facility so I can get your results. And one of our own nurses, this was her case, she said, am I gonna pay twice for this? And then the second one's out of network, and I'm gonna pay for that also? So, these are huge concerns. And listening to Nate saying that it went from October and they were still inputting, was it in May? He said they were still putting in data. I can believe that. I just can't even imagine how reimbursement will go. I want hospitals to stay in business. By no means do I feel like I want anything out of the ordinary, but I don't think people understand how unsafe it is when you go into a hospital that is under a cyber attack.
So we've been talking a little bit in this room outside at lunch about the long tail of these things, saying that, at the time when this first happened, it was national news, it was big news in Michigan. But to clarify, Ascension has come out with recent statements saying, oh, we're back online, things are back, but it's not back, right? What's the current status?
No, it's not back. There's still, and this was the icing on the cake of all of the safety issues. They were overriding every medication they pulled. So normally.
What do you mean by that?
So you go into a Pyxis, which is the cabinet you pull your medication from. It has a fingerprint, so it knows who I am. I put in the patient's name. The medications are all loaded in that the patient has been ordered. They've been reviewed by pharmacy. The second checks that Pyxis has, allergies, anything else. There's all these second chances to keep you safe with your medication that's being administered. They're still overriding all the medication. The Pyxis, they can pull it. They told me you can scan now, starting yesterday or the day before, that you can scan the patient's wristband, which is another great safety issue, safety chance to keep from giving the wrong patient the wrong medication. So, but they're still not up with that.
So this continues on and on. I'm curious, just given your discussion about the way that the hospital's communicated with you, leadership, you've gotten crickets. There's also this element of reliance upon technology that the younger nurses are not familiar with paper charts. I'm curious, throughout your career, can you speak just a little bit about how that's developed over time and whether or not in your emergency management plans this has been discussed at all?
There is no emergency plan. There's not. And I don't think the people that day even knew what they were handing out. And I think every day they were trying to make it better, but it made it worse because the paperwork was different every day for the nurses to chart on for every patient. So I think there was confusion and all of that. And I mean, you can speak to the petition. We sat down and very briefly we said, let's keep this simple. You know, number one, we wanted a daily huddle. A nurse is not a nurse is not a nurse. Every department is specialized and they all do things a certain way for their patient population, whatever it may be, orthopedics, pediatrics. So we need daily huddles for every unit. Secondly, we wanted training. There has to be some kind of training. Like I'm so jealous of the things that they do here to keep their patient population safe. They're ready to have had masks before COVID. Like I want to bow down before the person who ordered that stuff. Because I mean, you have to think, we just lived through a pandemic and it was the worst amount of death I've ever seen. And then to think, well, what could ever be this bad? You know, it's like, and here it is. The third thing we wanted was, we wanted a 1 to 4 patient nurse ratio, 1 RN to 4 patients, and for them to staff up. We asked them for it, we sent them a letter, please do this. When did they staff up? The 2 days they went live, this Monday and Tuesday.
So the idea behind that is that you want more eyes on the patient, given that there's not this technical monitoring to supplement that, correct?
Right, and so that's an additional. Natalie did a good job in presenting how when you have all these pieces missing, so the telemetry in that hospital goes from the monitor to a phone that the nurses on telemetry units carry. And it shows the rhythm, if anyone that they're caring for has a rhythm that's abnormal. That all stopped. The monitors were still present, but they had to pull the charge nurse into the role of watching all the monitors for all the patients so that nurses could be in and out of their own individual rooms caring for people. And then the charge nurse was also helping the health unit clerk, they call them a HUC, the secretary for every unit, would be helping them. And the people who run all over, running the labs back and forth, the tube system wasn't working the majority of the time. There's so many things that come into that. You need more people to run the labs alone. The paperwork to get the results was unbelievably hard, and things were getting lost between the floors. And as I said, even to find the patients, they were having to call every unit, do you have this patient? So, let's see, was I before? And the last thing was, they continued elective surgeries just like it was any other day. And there was problems admitting people paying. The communication was really, really poor. So they needed to stop elective surgeries, only do emergent things, and try to reduce admissions. I think they diverted, I'm not even exactly sure how many days exactly, but they continued to admit. So I mean, that just makes a cyber attack even more horrendous.
Talking about diverting resources, I think when we were bringing up rural healthcare earlier, that might be a luxury that facilities in more isolated regions don't have. I know that you don't work in a rural facility and we don't necessarily have a representative from one of those regions, but I'm sure you can extrapolate. How much harder do you think this would have been if you didn't have places to divert patients to?
I can't even imagine. I mean, nursing's been so impacted post-COVID, and it's not even that there's a shortage of nurses, it's that people just can't take the working conditions anymore. So a small hospital probably has, a quarter of the staff to deal with all the issues, and probably like a lesser technology, I would think too. I don't mean to, you know, I would worry that a smaller hospital, this would be twice the problem.
That makes sense. And I'm curious, just since you've been here, you know, last night and all today, you've been listening to a bunch of other sessions. Are there things that come to mind that you would add to your petition at this point, based on some of the conversations that you've had?
I think we could get a lot more specific after we've lived through all of it, you know, lab work. They did the things on Monday and Tuesday this week that should have been done day one. Hey, we need extra help. People were happy to do that. They wanted to alleviate the stress on the units, and so that we felt like we were taking the best care of the patients we could, and to upstaff us, but also to be more specific. Lab work, but the training, I think the training is so key. We're so not ready, and this hospital had stronger software than the second hospital, and I'm like sick to my stomach now. The things that have been brought up here, I'm gonna have new nightmares every day, you know, that I'm learning from the cyber community. So, I mean, I think it's really, really important. Training of preparedness is gonna be key. That everyone has some kind of training on the paperwork they're gonna do, how it's supposed to be filled out. It would make their stress level so much better if they had, oh, this is the normal packet we look at every year, a couple times a year. This is great, I can do this. How the lab should be done. What is the process? I don't think we were ready on any level. They had also outsourced part of their lab, so I'm not even sure the inside of that, because they outsourced it. So, I mean, there's so many things that we could be much more specific about now that we've seen it in action.
Absolutely, and I'm struck by this conversation, listening to Natalie, just how much I don't necessarily know about, you know, someone who works in an ER and what they do every single day, and how many little things can impact that day. I want you to just speak a little bit to why you feel like it's important that healthcare practitioners, from nurses to doctors to pharmacists, are involved in conversations about what policy should look like to actually address these challenges.
I think that many of the people here are pretty savvy. I was really excited to see that. And I feel, though, the administration portion of it is the fallout. I feel like to ever say it's business as usual, that is so disrespectful. We save lives for a living, we're not paper pushers, and to say that when people are struggling, that, you know, people were calling me crying and hysterical, that this is like not doable to do this job with this paperwork all over the place. So I feel like they're like, is it CU? I love, we need to partner together. I think we all need to figure out what we need on a straight up medicine level, and all of this is far beyond me, but I would be excited to hear your ideas and suggestions. But I mean, a hospital system, they hit 140 hospitals and in one corporation, so I don't know, we need to do better than this. Patient safety is like at the utmost importance. We gotta do something better.
And you're in Washington right now, you know, we've got people from sort of every community, but, you know, people from the White House, people from the Hill, who, you know, have conversations like this, maybe haven't talked to someone like you before, maybe they have. Do you have any additional things that you want them to take away from this?
I think at some time, we're all a patient, our loved ones are a patient, we're having babies, grandchildren, our parents are getting older. It's so important that we make sure this cyber safety is in place so that our patients are safe. I mean, I can't say enough that patient safety is the bottom line with all of this. And whatever we need to do to bridge that gap, and whatever we need to do to make the people who make the decisions at the top of these corporations pay attention, you know, this just can't go on. So I feel like I found another form of activism I need to get involved in a lot more heavily, so.
I guess lastly, and then I'll open it up if we have time for questions, because I'm sure this crowd is interested in asking some things. But I've spent most of my career covering national security. You know, I think about Russian hackers, I think about Chinese hackers, I think about how APTs impact our national security and our critical infrastructure. But more and more, these kinds of attacks are fitting under that umbrella. You know, we hear from the Biden administration that, you know, cybersecurity is national security. I'm just curious if you feel like that's really true. Is that becoming more true? Do you feel like cybersecurity of hospitals should be at the tier of national security?
Completely. I mean, it's our mothers, fathers, sisters, brothers, children, grandchildren. It's all of our families, and it could be us, any one of us. So it should be of the utmost importance. I mean, they have to do something different.
Awesome. Well, Josh, how much time we got?
Oh, there are gonna be some questions. I'm gonna guess yes.
Questions?
So why don't we do at least 5 minutes of questions? Is that all right?
Yeah, absolutely.
Can I give him the microphone?
I will do it.
Okay.
Thank you for your testimony. Have you had the chance to testify in good class? Because what happened is completely outrageous, and basically, unless the law change, the administration won't do anything. It's a sad thing, but corporation America is only interested about bottom line.
I so agree, and I would love to testify. I haven't had the opportunity yet, but I think something big has to change, because I think for a minute it's on the public radar for a moment when it first happens, and then it kind of just, like, people lose interest. But as it continues, the safety issues continue, and that's the most frightening thing, right there, so.
I think to just follow on that, I'm not gonna ask you for specific policy proposals because that's not your area, but do you feel like there need to be some mandatory requirements, or else these corporate leaders are not really gonna do it?
So that's interesting. We're fighting for a Safe Patient Care Act in Michigan right now. But now this is on my radar, and I said, we're gonna add contract language to all 3 of the contracts that involve nursing and radiology and get that in there. But now I'd like to fight for some kind of ratio. People can't be left in these unsafe situations. It just can't continue to happen. So, and until it happens to you, you don't realize the impact of it. So.
Hi, I'm one of those patients that I hope never has to be in the hospital when something like this happens, right? Or in the operating room. So I know that a lot of hospitals these days, and you work in radiology as well, so they outsource the reading of radiologic images. So you get your test done at the hospital, and then it gets like sent somewhere, and somebody remotely reads it, and then it comes back. Right, and so that's how you get your response. Has that come into play in terms of the training that you guys might receive in the future, or how the hospital and the nursing teams that work directly with patients might respond in this instance? I mean, obviously that couldn't happen, right? So these remote radiologic services have taken off like crazy. I'm wondering if you could kind of weigh in on that, since that's a bit an area that you cover as well. Thanks.
So I cover the nurses and the radiology technologists at this hospital. So ours is in-house. It was the medical lab technicians they outsourced. So that's the big fall through, that it's totally off-site now. So there was like a lot of confusion with the lab work. But we do have some satellites. So it was devastating for radiology too, completely. So I don't know like I said, they just are coming back up a little bit, Monday and Tuesday. There's still a lot of the services that are still down at this hospital. And I think we're gonna have to do a big analysis of what on our end we could do better. But what kills me is we're so happy to work with them. We would have been so happy to sit down with them. The other hospital during COVID, they pulled me out every 4 hours, like, hey, we need to do this. What are your thoughts? Like, we were so much more collaborative. And Ascension doesn't do that. So it's very disturbing that it happened May 8th and May 31st is the first time they sat down with me.
I think we just squeeze it in one more. Thank you for being here and for using your voice. I want to tell a very quick story. I was working with a surgical robot manufacturer, and they were told by the FDA to redo their authentication and encryption. And authentication with multi-factor is one of the repeated causes of attacks. So they redid it, and then their doctors, their clinicians, and their nurses rebelled because it was really difficult to use. It went from 2 clicks to 17, I think. Right, horrible. So I'm voicing this because I think it sounds like your voice is going to get louder and louder, and I hope you, in addition to do exactly what you're already doing, also tell the manufacturers of technology how you need it to look and how you need it to be, so they can build to your specifications and make your job easier.
Thank you so much. That's another, I'm gonna have nightmares forever now. But thank you for that
They
story.
fixed it too. It was just, it took another iteration.
Oh, well, that's, at least that's good.
It's hard enough to get people to do the 2 clicks.
All right, I could talk to you for hours. I know we talked a bit last night. The thing I'm gonna take back with me, besides wanting to work to do more on these and get you introduced to everybody on the Hill and all the people at HHS, so they can all hear, you know, a different perspective than they're used to, is just what CU said. Do we wanna take cybersecurity people and make them medical experts, or do we wanna make nurses have to learn too much cybersecurity? There's gonna be something that's fit for purpose, and we have to figure it out, but I strongly believe people with common cause, common purpose on patient safety, we'll figure out the right balance if we work together on this. So thank you for taking your own time to come here, taking a day off, willing to engage with scary people. We're not here to scare you, we wanna help each other for that common cause. So can we all thank Dina for coming out and for Jenna for helping to interview.
I just want to say a brief thank you so much to the cyber community. I've learned so much last night and today. I can't even tell you, and I'm grateful for like your kindness and like giving me tips on what to do when I go back home. And this swag is very cool. So thank you. I'm a fangirl and my NPR, so thank you.
Thank you.